América Latina tenemos hospitales, centros de salud, sistemas de salud que están trabajando por reducir su huella ambiental, que no solamente están haciendo acciones de reducción de energía, sino que van mucho más allá. Tenemos hospitales trabajando por la comunidad.
Hola, ¿cómo estás? Heather Lambert here, riding for Ride for Their Lives in Northumberland. The sun is shining, we're headed for Glasgow. We are, like you, trying to activate healthcare professionals to think about the health harms of air pollution.
Air pollution has enormous effects on health, from cradle to grave.
So to my left we have the local primary school with its playground, and to my right, literally at 3 metres away, is the entrance which, as you can hear, has a fair bit of traffic on it. It would be fair to say that the stuff coming out of the exhaust pipes of these cars and trucks finds its way very easily into the lungs of young people running around just here.
Let's now turn to the global health community because they have a very important message to share with you.
Hello everybody, I'm Dimitris Kondopidis. I'm a person suffering from lung disease and I'm a patient advocate from Greece. I already know how air pollution affects our health, my health and my lung health. But I would like all the patients that suffering for non-communicable diseases to be aware of this environment risk factor. So for this reason, definitely I stand and support this call to action.
We will do it. This is a huge task, but it's my honor to accept it, and on behalf of the World Health Organization, as one of the chair organizing this conference, I commit to make sure that I will take it and make sure that everybody heard this message. No excuses. I will bring it to policymakers, to ministers of health, to the assembly.
And we're here in Cartagena this week at the WHO Air Quality Conference, trying to bring the patient voice and the patient perspective into the debate.
On Monday, we had a ride, Urban Better and Ride for Their Lives, for air quality awareness and equally air quality measurement.
Calling for action with the global health community. Organizations of patients, health professionals, leaders and community members representing 47 million voices are demanding leaders and decision makers to act for clean air, for a better health for all.
The science is clear. Air pollution affects pregnant mothers, the developing fetus, the developing baby, and as the child grows up. Doctors see problems related to air pollution such as still or premature birth every day. Both the Royal College of Obstetricians and Gynecologists and the Royal College of Paediatrics and Child Health describe all the health impacts and, importantly, their recommendations in their position statements. We don't need more science, we need action.
Hi, my name's Alice. I'm a paediatric registrar. For the last year I've been a clinical fellow at the RCPCH Clean Air Fund Partnership. We know that air pollution is a significant threat to child health and that clinicians are some of the most trusted voices in society, and yet there are barriers in knowledge and time which stop paediatricians from having these conversations with their patients. To help with this, we've created the Air Pollution Companion, which is a one-stop shop of resources to support you having these vital conversations with children and their families. Why don't you check it out?
I've met so many exciting people and heard so many exciting things, and there's been such a feeling of hope that it's been great. Commitments from Mongolia were like really exciting. Most excitingly for me was mandating air pollution training for their healthcare workers. I'm really glad I came because I've learnt so much, and hopefully I've spread the word about how Ride for Their Lives work.
What we commit to do is to continue to deliver the messages of the experts like the World Health Organization and our relative royal colleges, to engage healthcare clinicians, frontline healthcare clinicians, in actually speaking truth to their patients.
Air pollution wasn't even something that was considered. Till now, to having it documented, we have come a long, long way. And there is a lot more to learn as we go along, but this is a start. Everyone in health, no matter who you are, you need to be aware of this topic. Knowledge is power, and there is 70,000 plus papers there about the impact of air pollution on health. These are things that all medics need to be aware of going forward. There will be no excuse in future to say, I didn't know about this.